there are some really
Take a deep
disturbing
breath,
language.
Saley.
I have to
Oh,
take a deep breath, but I enjoyed seeing Thu
I
lose
feel
it.
like I might have lost it. Hello, hello. Welcome to the HairX Runs Week at this podcast, where we share our thoughts on the pharmacy profession, experiences as healthcare providers, and explore our identities as two women of color going after it all.
Hi, guys. As we share our stories, we hope you laugh, maybe cry, and feel inspired as you get to know us. Because at the end of the day, friends, remember, we got this.
We got this.
Yes, we do. Hi, Thu.
Hi, good morning. How's it
Good
going? We're
morning.
so bright and cheery today. I love your shirt.
And the
Yeah.
shirt, and you with the popping lipstick. Yes.
Mwah.
Not the.
I am, by the way, my name is Thu,
Hi, guys. I'm Saley.
and I'm cutting us off at 1 hour today. I'm
We
cutting us
really are.
off.
We're striving. We're striving to get it together under an hour or at the hour. And Thu is going to be an enforcer, as she is
Yes.
always.
It's so hard for us because I feel like every time we have something to say, it goes to a different conversation than the next and the next. And it's like it could just be 10 hours long. And
It
then,
really could. Hence why we need a live podcast episode.
okay, we've got some updates to give people. So, first of all, this episode is coming out the second week of March, I believe,
Yeah.
in the beginning of March. So we typically publish an episode every other week, every other Tuesday. So this one is going to be in the beginning of March. So a couple of updates for that. First of all, we have this Trust Yourself challenge, which for February, I just kind of threw it out there because I knew we needed to do something soon. So for March, please look out for the Trust Yourself challenge and participate. Let us know how you feel about that. For February, it was Love Yourself, which you're supposed to say 5 things that you like about yourself. Saley, can you name 5 things? Like, you don't have to do it right now, but in general, can you name 5 things that you like about yourself?
I think so. I think 3 is super easy. 5, I may have to think a little bit more.
Interesting.
I
I
know.
know. You know, it's so weird because you're like, oh, 5 things, easy. But then when you actually do it, it's
Yeah.
not that easy. And you
I
really have
know.
to think about it, which is so shocking because
I
you
know.
think that we would know what we like about ourselves more than what other people would think.
Absolutely. And I think also like the other component is like I'm super cerebral about this stuff. I think about, okay, there are some things that people tell me they really like about me, but I want to change that about myself. Like I think, like people think are great attributes, but I think I want to change it about myself. Like I think I'd like to become a little bit more observant. Like just instead of just being super like, wait, what? Absolutely not. Like I
Like
know
reactive, you mean?
yeah, reactive. I think I know how I feel about things the moment I hear it. Like I'm either with it or I'm not with it. But you don't have to kind of worry about how I feel about stuff. Like, and I don't know if that's still something I want to keep about myself, but it has worked out. So I don't know
Yeah.
if it needs to change. Like it has really, really worked out.
Well, I think the whole point, right, of that trust yourself is like no matter what people say and think about you, you have this already core belief about who you are. So then if people are like, Saley, I love that you're so passionate or whatever, and then you're like, oh yeah, thanks. But if you don't feel comfortable with that, I guess. I don't know if that's the right example, but I don't know. You
Yeah.
know what I mean? Like you have your own opinions about who you are, and that's
About who you are. Yes.
that's the one that you should value above what other people think. Because at
A
the end of the day,
100%.
friends, you're the one that has to live your life.
Yes, you do. Yes, you do. Like in the quiet moments, it's just you and your choices. Because that's what it comes down to. It's just
Yeah.
you and your choices. So it's like, it's why like I felt people are like, do you regret that? I'm like, no, like I have very few regrets because that's what I wanted to do. Like that's legit what I wanted to put myself, my energy, all of my bandwidth behind, and I moved according to that. Regret, no matter how that turns out, that doesn't get to be one of the words I would use to describe that experience. And I think like what we were when we talked about the whole trust yourself, love yourself challenge, it's that. It's like helping each other kind of lean into whatever that feeling that you have, even if it scares you to death. Like, trust
Yes.
yourself to do it.
Trust yourself. And then the other update is match day this year is on the 14th of March. Editing through here, it's actually the 13th of March. I apologize if I freaked anybody out from that mistake. Hee hee. Which I don't know how everybody's feeling. You know, check in with us. Make sure that you're doing okay. Make sure that if you need the support, we're here to help support you. But one of the ways that we're helping to support is we're doing another live episode, which is so wild because who are we to be doing all these lives, you know?
We went from, but very typical and on brand for us though, 0 to 100, real quick, in a fraction of a second. We went from not even being able to figure out how to go live to the platform epically failing us.
That's so funny.
Now we're just gonna jump on a live just cause.
Yeah, exactly. Like next week, okay, we're there. But this one, it's gonna be kind of like a check-in pep talk kind of thing for the people who are going through the residency match process and wanting that support 2 days before you get your results. I know that is such a scary time, and I don't even like if I think back to what it was, I think you've all heard my residency story, but I think I was kind of like just very hopeful because that's just who I am.
Yeah.
But you know, always in the back of your brain, it's like that fear and uncertainty, and that can be very stressful. So we want to make the process a little bit easier, just a little bit, because it's still going to be stressful. But whatever we can do to help, we're going to be doing that on Monday, March 12th. Editing through here, sorry, but another mistake. It's actually going to be Tuesday, March 12th. Last mistake, I promise. So look out for all of those promos that we're going to be doing.
Fun stuff.
Fun stuff. And then lastly, Saley, do you want to give an update on the live episode at all?
Guys, this live episode is happening. It's going down. It's going to happen. I just need you to keep in mind that this year in NOLA, at the ASHP mid-year clinical meeting, Hey RX Friends, We Got This is going to be hosting the event of the conference. Forget what you've heard. This is it. This is where you want to be. This is the thing you don't want to be on Instagram just seeing it roll out.
Oh no, don't
you
miss
want
out
to
on this.
be there. You want to be there so that when they're talking about it, you're like, oh yeah. And this part and that part was so cool. But Thu and I are taking an incredibly bold step forward as a new brand for this podcast to bring the podcast to mid-year and record a live episode where we want you right there with us, chiming in, baby, giving us what your thoughts are on what we're talking about. But again, it's just staying true to that thing that she and I both wanted to do, eliminating the isolation, the confusion, and the shame that really goes along with so much of what is the profession of pharmacy, through authentic story, relatability, and building this community. This is ours to do with whatever we want as a community. And this live episode, y'all, this is the beginning of a bold step forward towards realizing one of those dreams that we had.
Yeah, it's quite shocking to know that we started being so shy about starting a podcast and now it's a couple months in. But I want to give credit to our business leader here, Saley and Thu. Wait, how do you say your name again?
That was perfect though. Wait, that was great. Yeah. Dude.
You know, but you are our fearless business leader in the way that you're really pushing this business and this brand forward. You know, because for me, I was just thinking like, oh, this is going to be a podcast and we're just going to be uploading. And here comes Saley being like, no, we're going to do this and we're going to do this and we're going to get sponsored and we're going to create this big live event, which never in my wildest dreams did I think that I would ever be a part of. So yeah, huge credit to our amazing leader. And I cannot wait to bring this to life. So,
oh my God. First of all, guys, I know you guys know she's being super modest right now. I hope you believe that, but I am lucky that I have a partner who literally thinks as big as I do because they live in my head for so long where I'm like, I'm insane. And I connect with Thu. She's like, and we can do this and this. And I'm like, oh, yes, let's do that. So this this does
We're on the
not work.
same page.
Yeah, we are on the same page. So look out for all of what she's just announced, and we'll keep in your feed on social media. It's keeping you abreast
Hmm.
with all of what we're working on. What we're talking,
It's
what are we getting into today?
Oh my gosh. So, I mean, today is going to be an episode to remember, and Sally is going to go off, and we are
You
so
see,
living for it.
you see, she's setting you up again for a massive thing I think I was really in my journalism bag with this
Oh,
one. I
yes.
I I went in. So if you have not been kind of staying on top of pharmacy current events in the last, I'm going to say we're talking weeks right now because
Mhm.
many of the things that have come out have been in February and January of this year
Mhm.
that have put this topic back, like on my radar. But I don't think it was ever on my radar the way it is right now. And that could just be because I'm keeping a tighter pulse on what we're talking about in pharmacy. A few weeks ago, I was on LinkedIn, as I always am, looking around, looking around, and I saw a post. And I'm so sorry that I can't even give this person the proper shout out and credit for their post. But there was a post, a pharmacist was highly upset about a position statement that the AMA, the American Medical Association, had come out with a position statement, and her opinion or her reaction to this statement was specifically about their opposition to pharmacists being able to continue to do a series of tests called CLIA-waived test. And I'll explain a little bit of background about what some of all of these terminologies are so that we don't lose you as I begin to have my little meltdown. Like you understand.
Oh my gosh. Okay. Wait.
Right. You said I was going to go up. I said I'm going to have a meltdown.
Before Sally's meltdown, I do want to remind everybody that if you are watching on YouTube, please like the video, subscribe, and write the comments below. Let us know how you are feeling with the American Medical Association statement, their scope creep, what is it, campaign that they're doing against a lot of other healthcare providers, not just pharmacists. And
Yes.
let us know your thoughts and opinions on this too. If you're listening on the podcast on Spotify and Apple Podcasts, please write a review, please rate us, and share
Yes.
our episodes to the people that you think may actually enjoy us. I love our listenership. We are growing, and everybody's so excited to hear us put
Mm-hmm.
out a new episode every other week. And it's just been a phenomenal experience. And please invite more people to join in on the
Yes.
fun. All right, Sally.
Because it really is fun. Like we are the fun podcast over here. Okay. So let everyone
Who
if you
else
saw
dances on their Instagram?
if you saw Thu's fun dance, you know that this is legit over here. Okay.
Yes, exactly. All right.
So
Okay, Sally.
I wanted to go back because I knew that I'd be adding my voice to this whole thing. So people who know me know already that policy and advocacy, this is something that is of interest of mine. I follow it closely. I've done advocacy on Capitol Hill as a kidney disease survivor, fighting to get bills approved for better prescription drug coverage for people who suffer and live with chronic kidney disease, transplant patients who end up losing vital organs because they can't afford their copay on their anti-rejection meds. I like it. I think it's a great space for dialogue, exchange, and conversation. So it's one of those hashtags that I do keep an eye on. So when this popped up, I was just like, ooh, position statement, like all these keywords on policy. So I went and read up about it. The more I was reading about this, the first thing that surprised me, even as a person who, since a student, was interested in policy and advocacy, was that the conversation about pharmacists' ability to do more to improve access to care for their patients. It's not new. We have been in this fight, and we haven't been the only people in this fight, as you mentioned, through like other advanced practitioners have also been in this fight with us, alongside us, for a really long time, like predating us becoming pharmacists. So this isn't new, which is like the part that really surprised me as I was looking
Okay.
into it.
Wow. So where does it, okay, so give us a history lesson. Everybody
History
knows I
lesson.
am not good at history, but please, you
You guys,
you are the expert here. So please
she's so
start.
funny.
Where does, so what would you, how far would you go back? Like,
My God, the 1800s.
what?
I know. So we start with a governing body being established in 1847, the American Medical Association, that we now know to be this giant in healthcare as the
Oh,
AMA.
so we're talking about an organization that is deep rooted in American history.
American history, American politics, American policy, the development of politics, policies, and healthcare. Their history alongside policies and politics in our government, it runs deep. And I think to their credit, they have had time to get organized. They have had time to get organized and get right with their messaging so that what they want is really what they get. And that's what I was learning. So 1847, they are established. And when you go on their website, they are really proud of their history, as they should be, right? Like any organization, I would say. And there's all these different facts. Like in 1905, they established a Council of Standards on Drug Manufacturing and Advertising, right? Medical Association. In 1972, they launched a war on smoking, urging the government to reduce and control the use of tobacco.
So
Their
it sounds
mission,
like they have a lot of really good causes,
a lot
right?
of really
Of
good
course.
causes that actually perfectly align with what we and all of the governing bodies, APhA, ACCP, fight for pharmacists to get. They are in line with a lot of that. In 1986, discriminatory legislature that basically barred access to patients based on race and other things, especially for HIV patients. They make moves to try to abolish those legislatures. In 2008, there's an apology that comes out um, from an ex-president for policies with the AMA that excluded African Americans from being a part of the AMA. 2008, like that's not a lifetime ago. That's like our lifetime.
What?
So
Was
the
that when President Obama was in office?
yeah,
What the
from 2008, yeah, our lifetime, they're issuing apologies for policies that excluded African Americans from being a part of the AMA. So they have good history with patient care and healthcare, but they obviously are still reckoning with some things that they were rectifying. And I appreciated that transparency when I was looking into them. The fight for healthcare, though, they have been very consistent in their messaging and being opposed. I'm going to focus on pharmacy here because that's our business, but they've been consistent in their messaging about anything that ever sounded like pharmacists were going to go outside of medication management. Immunization was a struggle before we were able to get approval for that, and the fight and the push for legislature around that. But why this is happening right now, it's because during the pandemic, there are several things and several steps that were taken to improve access to care. And it was recognized that pharmacies and pharmacists were uniquely positioned to fill a gap in improving of immunizations, improvement of diagnosing COVID and providing treatment for that. So there were all these inclusion of pandemic measures to add to the CLIA-waived testing to give pharmacists access to diagnose and treat COVID. Now that we've kind of come down from that, the conversation's been reignited because they have come out and there are some really
Take a deep
disturbing
breath,
language.
Saley.
I have to
Oh,
take a deep breath because my chest gets all
disturbing.
tight. There's
Yeah.
some really disturbing languages that the AMA is using that's not productive to what we know to be true about healthcare in America. There are areas in this country where people cannot get primary care provider visits for 50 days. They can't get a specialist for up to 6 months. Their nearest pharmacies or healthcare facilities, they're traveling for up to an hour or more. Their community pharmacists are number one. They are at the top of the list of people that these communities rely on to help them. And so when languages like AMA defends medicine from scope creep anytime and anywhere, like they're using language like scope creep. And I think like some of that is dangerous because it just makes it seem like we want an expansion in what we want to do.
Well, the word creep is not like a positive one.
Well, yeah, that was the
Like that's
title.
already the image of like a creep, you
Yeah.
know?
Wait, you got to do it again.
Yeah, please. If you want to see what I just did, watch on YouTube.
You have to watch it on
my
YouTube.
impression of a creep.
A creep, right? But then it's like things like pharmacists do not have the training and expertise to diagnose and physically examine a patient. They should not be diagnosing a patient simply from a test result. So let's talk about this test result.
Well,
Let's
let's break
right
it down
click.
real quick because I
Uh-huh.
do agree with the statement of pharmacists were not trained to diagnose. Like I think that
Right.
it needs to be clear that we agree with that. Like I'm not here looking to diagnose anybody with anything, right?
Mhm.
Because
Yes.
we're not trained in that at all. Like that's a
No.
huge component of
Mhm.
medical residents training and doctors training or physicians training.
100%.
So,
You will be hard pressed to find a pharmacist that is going to argue against that statement, that is
yeah.
going to say, no, I have the training to diagnose.
Yeah. And by the way, like
We're
let's
not
just
interested in that.
I want to do a quick like veer off a side note for me, right?
Yeah.
I don't like the idea that some people may think that like pharmacists are like that we want to be doctors.
Uh-huh.
You know what I mean?
Yeah.
I've had so many experiences in the workplace. Like when I first started my first clinical job, of course I looked a lot younger. Like you can tell that I'm fresh off, school. So
Yeah.
I've interacted with doctors who are like, so like, are you interested in medicine, like medical
Medical
school?
school.
I'm a pharmacist though. Why would I go back and be a doctor? Like that doesn't make any sense, or a physician.
And yeah.
It, but it's like it's almost like this thought, like that
Hmm?
that is the dream.
Yeah. It's the pinnacle.
I'm still stepping up these steps to become a doctor, but
Yes.
I'm like, but I'm already set in my career. I don't, if I had wanted to be a physician, I would do that,
Thank
but
you.
I don't.
Thank
And
you.
I'm
Please, thank you for saying that.
now that I'm in healthcare and I see what everybody does and I
Yeah.
see everybody's roles, I am blessed to be a pharmacist. I
Thank
like my
you.
role.
Yes. Oh,
So I don't,
that should
and
go on a shirt. I am blessed to be a pharmacist. I love my role.
yeah. Okay, merch.
Yeah, merch, right? It's a t-shirt statement because it is a true misconception, not just in our patients, but when other healthcare providers hit me with it, it's disheartening because I tell them like, who else can keep your malpractice insurance down the way I do? Hit me like, who else? You don't want this smoke. You don't want this smoke. Don't come to me telling me that I should go to medical school. Oh, you're so good at this. Don't you want to go to medical school?
Yeah,
Believe you me, if medical school was the goal and the aspiration, that's where I would have
I
gone.
would have done that.
I would have done that.
I'm
This pharmacist has zero interest in becoming a physician. More power to you. I like my role at keeping your malpractice insurance down. I really love it.
yeah, this has
Good.
nothing to do with like something is better than one another. I'm just saying that
Yeah.
please open your mind. I mean, most of the people who are listening to this episode are going to be pharmacists,
Yeah.
but if you're not and you're a physician, somehow stumbled on this podcast, just open your
Yeah.
mind to the idea
Not,
that not everybody wants to be a doctor.
not everybody. Not
Yes.
everybody.
So next,
Yeah, no,
let's go
very
back.
good. Very good place to right click. So these tests that they're talking about, we're not talking about pharmacists going in to interpret an MRI result or a chest x-ray, or that's not what we're talking about here. We're talking about an amendment that happened in 1988, right? Thu, were you born yet?
1988?
Yes.
Okay, no, not yet.
I always have to remind the people how young we are over
But
here.
I'm
I was
not. You're the only person in my life right now that tells me I'm young.
oh really? You are so young. You have to embrace it. An amendment that happened in 1988, and you'll hear it referred to a lot as CLIA-waived testing, but the CLIA stands for Clinical Laboratory Improvement Amendment of 1988. And the act essentially, it was a federal act that regulates, including federal standards applicable to all US facilities or sites that test human specimen for health assessment or to diagnose, prevent, or treat disease. Notice that the treat is a component. There is diagnose and there's prevent. Most of the things that we are interested in is for early disease identification for the improvement of population health and to prevent the spread of disease in the community. We are not asking to go in and interpret CT scans and MRI scans and VQ scans. We are talking about tests that will allow community pharmacists in remote areas, right? In areas where patients have to travel really far to find out if they have strep throat, if they're HIV positive, if they are pregnant, if they what their hemoglobin A1Cs are, what their INRs are, right? The ability of that patient being able to know locally what's going on with them in regards to those things so that that pharmacist can help them. Because part of our training also, surprise, surprise, is to teach us what our limitations are. It's like we know when we can tell that patient, don't leave. I'm going to call an ambulance for you. You need to get to a hospital right away.
Yeah.
Or you need to go, let me call a doctor that can see you right away, right? Or you need to get to your OB-GYN right now. Walk into the office, don't make an appointment. Tell them you came to see me, this and this and this is going on. But with language, like we are scope creeps, pharmacists are fired up, and I love it because,
It's very rare to get us to be that fired up.
to be that fired up. And I think we've talked about this on here, right? There are expectations about how we should describe or articulate that we are unhappy. We talked about this on this podcast. We are expected to be tactful, but listen, the current CEO of APhA, he's just right
Oh
now.
man.
I had the privilege of meeting him, I think about a month ago. He was invited at Howard University to come speak. And of course, I was in the room. And everything
You
I'm
have your
reading
little
online,
sign that says, "Marry me." No, just kidding.
I just said, Michael Hogue for president. And I'm like, oh, wait. But I've been in the room to hear organization heads speak a lot. There was something different about what I felt hearing him speak that day. And I think part of it, in all honesty, I went to that meeting to see if the voice, the tone, the energy I get from his position statements on social media, if that's the same thing I'm going to get in person. And it was. And that was pleasant. That was refreshing. It was so welcomed because oftentimes the energy and the vibe you get online and when you meet people, they're not keeping the same energy. And when I met him, he kept the same energy. And he was like, if I say something and you don't see any action behind that when you see me, or send me an email, I think he said he wanted the subject of the email to be like, don't just talk the talk, walk the walk. Like he explicitly
Nice.
told us that, right? So of course, like I was looking to see what he was saying. And the first line of this thing,
Should
I
read
don't
it
know.
verbatim. I don't
I
know.
need
We
to,
could.
I have it. I'm going to
Okay.
read it
We need
verbatim.
it
I'm going to read
verbatim.
like excerpts from it verbatim
Yeah.
because I was just here like, oh, I'm going to
See,
faint.
like we need a pharmacy leader who can speak up for us like this.
Like this.
You don't typically see, and I'm talking about even in
Yeah.
the workplace. I've had
Yeah.
supervisors who are
Yeah.
absolutely terrified to go against, the medical leaders,
Director.
the
Yeah.
directors over on the medicine side. So then you see pharmacists being played so small because of the inability to advocate and speak up for the pharmacy department. And I'm talking about just individual facilities. And now we're involving the entire national organization. But it's so refreshing to see somebody
Ugh,
not being afraid to step up.
afraid to step up. And as so let me just put everyone out of their okay, well, what did he say? Everyone's listening, like, okay, well, can you just spit it out?
Well, actually, hold on. Before you, I know we're kind of going all over the place and I may need to edit this, but do we want to read any of the excerpts from the AMA statements at all? The actual verbiage in the AMA letter, and I'll read it out loud here.
Yeah.
This is the part that is really shocking. It says
Yeah.
pharmacist education is focused on learning about medications and includes much scientific laboratory study, which that's not accurate, but not training in providing medical care to patients. What does that
Not
mean?
trained.
That is
What
the
does that mean?
vaguest
Yeah.
term that you could use.
Yeah.
Training and providing medical care. What
Medical
kind of
care.
medical care? Because medical care could be really anything,
Anything.
right?
Education included. Education included.
If you're talking about medical care, nurses do a lot of the medical care that physicians don't do. So, like,
Correct.
what is it that you're actually saying?
Saying.
Because it's so vague.
It's
And
very
so
vague.
it says here the patient care activities in pharmacy school include interacting with patients, ensuring continuity of care, educating patients on the use of medications, but do not include making diagnosis or developing a differential diagnosis, performing physical or mental examination, or managing chronic disease, which some of that is accurate, but we help manage chronic
Chronic
disease. We
diseases.
actually help manage diseases in general.
Yes. Yes. And again, the fact that they're out of touch, right? Do a literature search on pharmacist contribution or pharmacist-led clinics around this country in chronic disease management, you'll know how out of touch that statement is.
Yeah.
And this is why I'm so passionate about telling students and my other colleague pharmacists the importance of publication. But then I see things like this, and it's almost like, why do I even tell people you need to publish every little thing you do?
They don't read any of
They
that.
don't
Yeah.
read any of that because
But
the
you would be
success.
surprised because no, it depends on where you practice, right? The pharmacists are there, like if especially if you practice in a clinical setting, like in the hospital or a clinic,
Yeah.
there are pharmacists there making very clinical recommendations to our physicians
Yeah.
that are helping manage diseases, whether or not chronic or not. They are helping, that Vanco dose is incorrect. You need to increase your apixaban dose. You need to decrease your apixaban dose. I mean, if the doctors aren't aware of that, that can cause so much harm. That is disease management. Like, yeah, the diagnosis part and the differential part is extremely crucial, but once you've narrowed it down,
Yeah.
then
We
like
got it.
you need pharmacists to help you.
We got it. Like we got it from there. And like let's not even talk about the long history and well substantiated of anticoagulation clinics and the contribution that AC clinics have made to decreasing the burden on physician practices when they were managing those things. Like
100%.
we just went through a whole pandemic where pharmacists were immunizing insanely and people, right? Rest in peace.
I'm getting kind of pissed right now
Oh, no, but
because of the things that I remember my medical residents would call me up and be like,
thank
I
you.
need to do this. Can you help me with this?
Thank
We may
you.
need to start digibind on a patient. Can you help me with
Oh,
this? I'm
yes.
like, and the fact that you are taking that away, like as soon as somebody's like a question of medication, is immediately like, make sure you check with pharmacy. Are you effing kidding
I
me? The stress
know.
that I have in
Yes.
my job, because
Yes.
I'm also there helping my patients, making sure that everything is safe and
Yes.
optimized and effective.
Yes.
I pour a lot of my heart and soul into these patient
Yes.
cases as well. And you're telling
Yeah.
me that I'm not helping with any of
Yeah.
that?
Yeah.
Give me a break.
I see.
This is making
See.
me upset.
Okay, but you're fired up, and this is making me feel a lot better because again, you're not leaving me out there by myself with all of the frustration I feel. The point that they are pushing is that our training only puts us as expert in drug and drug
Right.
therapy
100%.
management, right?
Yeah.
That is true. But what our training has what that statement told me is that they are out of touch with what has happened in the profession of pharmacy in the last 2 decades, right? The requirement of the PharmD to be entry level for a pharmacist, that didn't just happen because we wanted like, or the accreditation council thought that an extra or a new acronym would be cute or interesting. But there was direct effort behind making sure that the curriculum actually reflected an extra degree of expertise in interdisciplinary collaboration and in extended training in physical assessment and patient triaging, limitations to self-care, and others that the PharmD has with it. You take that PharmD and you couple it with residency requirements and now fellowship training and all these other things.
Yeah.
That statement to me, it revealed that they are out of touch with what our training actually is. Thank you for getting it right that we are the expert in drug and drug therapy management, but also we are collaborating in interdisciplinary teams on ICUs and infectious disease consult services.
Just like we put so much effort into taking care of our
Yes,
patients, and it
patients.
just drives me nuts that people don't see that. Like
No,
when a
I
patient
think
is
people see it. I want to like make like right click on that point a little bit in that she's like right click in that the AMA believes that they are speaking for all physicians in this country. The danger of that is I work with physicians that valued, respected, sought me out. Like I am at home on a weekend, they will text me because they wanted my
boundaries,
input.
physicians,
I
boundaries.
know boundaries. I have those issues, right? They will seek me out and they will text me and say, patient's leaving today. I just need to make sure that when you come in tomorrow, you have a continuity plan in place because INR just became 2 today. I don't think there's a reason they need to stay here. Can you help? Do you have them? Make them priority.
1,000%.
How many of us, I am not special, unique, or even anything in that regard. I know that there are thousands of pharmacists around this country that have those types of relationships. I know pharmacists that have retired where physicians are reaching out to them for
Yeah.
assistance because they've left a vacancy in that area. So what made me very angry about the AMA's language, their verbiage, and their position on all this is that you are viewed as the authority and that speaks for all physicians. When I know that my physician friends, my friends that are physicians, they don't see me particularly that way. They're rather impressed by my skill set, right? They don't, and their relationship with me and knowing what my training is has been transformative to the relationships that they have built with the pharmacists in their practices. So when you make statements like that we don't provide or we're not trained and our education doesn't allow us to provide medical care for the physician that is a
So
second
wrong.
year, that is a third year, that is just graduating from medical school and hasn't had an opportunity to see us in action yet, it's dangerous rhetoric when we are working actively to improve multidisciplinary models around this country because we know. Why do we know? Because it's published, it's been substantiated by
But
multiple people that we contribute positively to patient care in this country. It's 2024 and rhetoric like this is still out here. When I saw a letter from the previous person that was CEO of APhA, Tom Manigan, where 7 organizations got together to draft a letter opposing similar language. I believe it was back in 2010. We are right.
yeah.
Like it seems like
Yeah.
it seems like we are just in this holding pattern where the moment pharmacists are trying, and that's what it is. Like I don't know why we're calling it something else. The fight the pharmacists are in, it's because we want to improve access to care. That's what we want.
And just in general, improving patient care. Now, the letter from the AMA, that whole document, of like scope creep, obviously the person who wrote this has a very different agenda in mind than patient care. Because if you actually care about getting patients the right help or the right management, then you'd want a team behind them. You want interdisciplinary management. You can't be putting all of it on the physician's shoulders because of their training. Because what you're putting your fellow physicians under, and what you're expecting I can't even speak because I'm so freaked out. What you're expecting physicians to do is to be the sole provider, which is like, why would you want physicians to be the sole provider to be handling all of that stress? This is a group effort. It has to be, or else it's going to fail. And I mean, you talk about me seeing medication errors coming into the hospital. Like the error is significant enough that the patient ends up in the hospital. And you're saying that no, like let the physicians handle it. Everybody else is not able or capable. That's why you see the failure that you see is because the lack of support for the physician and the patient. Like if you actually care, I don't know what the motives behind writing this is. I don't know what the motivation behind scope creep is. For me, I think it's money. I think it's reimbursement
Oh yeah.
um,
Well, that's a whole
issues.
thing.
It's wanting nobody else to receive that other, you know, financial support to
Support.
expand your practice. It's like everything
Absolutely.
has to be for the physicians only. And I understand why they may make that, but when it comes to the money side of it too, that is just greed talking now.
It is.
Because it's not patient care talking. There's
It's
no
not.
patient care focus in this messaging. Like I don't see any of that.
100%. And I think like when you look at that statement as a pharmacist, whether you are, because the voice and the position in pharmacy, we don't tend to agree, which is what's different about the AMA. Like they're on messaging 100% of the time, right? But
Yeah.
on this issue, we consensus is pretty solid in pharmacy in that what we provide absolutely is care.
Yeah.
What we do definitely matters in our community. We know that, but this is why I think like speaking out and speaking up about what we do is so important. Is so important because the people that we are side by side with, they don't see the value in it. And Michael Hogue's statement from February, like we're in it, of 2024, and why I think it's so important and why it's reassuring and why I am feeling really encouraged by this new wave of pharmacy leadership. The first line reads, and I quote, "Everybody knows that bullies don't care about what's in the best interest of anyone else around them. They are simply focused on their own insecurities and self-interest." I was
Oh,
like, I don't need to read anymore.
work.
That's it. Work. That is it. I mean,
Oh, yeah,
that
that was it. We're
was
done.
it.
We don't need to read anymore. Oh my
Mic
God. I
drop.
mean, way to call it out.
Out. Right? Isn't that
No more
refreshing?
tiptoeing. No more
Isn't that
tiptoeing. Ah,
isn't that refreshing?
so
It
refreshing.
was it was a person. Like, if you forgot what I said, who Michael Hogue is, he's the CEO of APhA. Okay. This is the largest organization representing pharmacists and pharmacist interests across the profession. APHA's focus is not specialty pharmacy, community pharmacy, health system pharmacy. It's all of us who call ourselves pharmacists. The person that is our face of that organization says something like that, even if Thu and I tweet or post on LinkedIn all day and we get 1,000 reactions from our post, we know that the AMA is going to see this. We know this for sure because they have
Mm-hmm.
press people that are going to make sure that this lands on the desk of somebody at the AMA. And when they read that, they're going to read that in the voice and the tone of the 60 plus thousand pharmacists that are APHA members. That's what I loved so much about that being the first sentence of this statement.
Hey,
Because
RX friends. We need to, I don't know what we need to do, but we need to make some sort of graphic and then we all share that graphic.
yes,
somewhere, somehow. Maybe I'll think of it. But like, we need to spread that particular message out there and say, do not mess with pharmacists.
No,
I know that we've been stepped on for so long, but that's it.
that's
No
it. We're done.
effing more. This
Yeah.
is the end. Do not come for us
Us.
because we will snap right back.
We'll snap
Like, this
back.
is what you're saying about us is not appropriate, and we are tired of being stepped on.
Mm-hmm.
You and I mean, we've said a lot of opinions about the pharmacy profession on our podcast.
Podcast.
And I think we've gotten pretty comfortable about advocating for who we are. There's so many people
Yeah.
that's like, you are like the UPS drivers. And we're like, no, we're not.
No, we're not.
So
Don't
I'm
ever say that
so
to me.
glad to see
Yeah.
that this type of response is happening, that we're
Happening.
not just going to be like sitting back and taking it anymore. And
Oh,
yeah, it just makes
it's
me feel
just
great.
so good. And he continues, and I quote, the continued harsh and unprofessional language published by the American Medical Association confirms for us that AMA has become a bully, unprofessional, completely disconnected from the reality and intent on getting their way no matter what is in the best interest of patients.
1,000%.
A
Oh
thousand
my
percent.
God.
And
Oh my God.
he calls for a public apology. Oh my
Oh
God.
my God.
I could
We
go
should also be calling for a public apology.
public apology. Like I quote, we're calling on AMA to apologize for its unprofessional article and retract it entirely. Other organized medical association, many of whom APhA and the Medical Association of Colleges of Pharmacy work very closely with, must condemn AMA for its bullying tactics and urge them to focus on addressing healthcare disparities and improving access through interprofessional practice as
Nice.
called for by the Interprofessional Education Collaborative, to which both AACP and AAMC belong. So what he's alluding to there is there's already an interprofessional education collaboration that they are a part of, and the language of this position statement completely goes against that.
You know what's so interesting is I'm looking at the article from AMA right now, and I clicked on the author, and I don't even think he is in healthcare. It says here Timothy contributes news stories on a freelance basis. He was a senior staff writer at the AMA from 2016 to 2017 and has more than 10 years experience writing about healthcare. He previously served as director of communications for the Venice Family Clinic, the then largest free clinic in the country, where he wrote extensively about accessibility of care, healthcare reform, and health policy. He is a graduate of Indiana University. I don't even think he's a healthcare provider.
Interesting.
So, like, who's vetting these writers?
Or interesting selection of
Because,
person
when we talk about the fact that whoever wrote this is probably not even practicing, has no idea at all what pharmacists can do. AMA, you're choosing someone who doesn't even understand pharmacy to write an article about pharmacy.
Allegedly.
Oh, that's true. Allegedly.
Allegedly.
Uh,
But, and I think, our intent with this episode, number one, was to make our listeners abreast that this conversation is happening right now. Please contribute, lend your voice to it. And number two, if you've never heard of what CLIA-waived tests are, please go read about them. There's so many of them. Like, these are tests that are so easy to do that you probably are doing it at home yourself, like a pregnancy test, for example. CLIA-waived testing, or like kind of idiot proof-ish, right? So educate yourself about what they are saying we are not educated or trained enough to do. And also, I am advocating openly that you send Michael Hogue a shout out and just say thank you for showing up and standing up for us.
Let's do that.
And me and my crazy delusional ideas. Like, I'm gonna email Michael Hogue and ask if he wants to talk to us.
We should email
totally
him.
do it. We should totally do it.
We should,
You see,
yeah.
this is what I mean when I have a delusional idea and I say it to Thu. Instead of her saying, "Girl, we're not there yet," she goes, "Yeah, do it."
What? Why not?
Yeah, we could totally do that. We
I
could
mean, I
totally
may
just
draw the
email
line
him.
at like going into space, maybe, because I just don't know how safe that is. But that's really where I draw the line. So whatever delusion Sally has, I'm like, it makes sense to me.
I'm done. But yeah,
Um,
that's all I had on that, and I am rather proud of myself. I didn't lose it, but I enjoyed seeing Thu
I
lose
feel like
it.
I might have lost it.
I thoroughly enjoyed listening to Thu just go off. It's my favorite when she just gets all upset over
I'm
stuff. I love it.
I love it when you're upset. I just love it. Um, wow, yeah, no, I'm really glad that we're talking about this, and I hope that we can inspire more of our listeners to step up and advocate for this profession. And I think this episode definitely is one that if you feel passionate about it as well, and you feel like what we're saying matches how you feel, please send it to the people that needs to hear it as well.
Absolutely.
We want this to be an example of speaking up and advocating for pharmacy, and
Yeah.
our experience is so important to that conversation. So,
Very.
whew, do you have
I
anything
know.
else to add, Sally?
Oh no, just to all of my fellow pharmacists listening, there's no one coming on the white horse to rescue us.
Ooh, yeah.
There's nobody coming.
Maybe Michael. Maybe Dr. Hogue.
Michael, I think maybe Michael Hogue is coming on the white horse to rescue us, right? Like, because it's not the first time that he's shown up this way for us, right? It's pretty
Yeah.
consistent. Um, but we really have to let go of the idea that it's somebody's job to make this profession better for us. It's not. It is up to all of us in how we use our voices, how we use our training, how we build the relationships, how we encourage our patients to even show up for us. I think my love, interest, and passion for policy and advocacy is that it's the self-realization that I am the person. I have the power to change my circumstances. And so for that, I have to show up in order to make the changes that I want to see anywhere.
Yeah.
So the
Yeah.
changes we're talking about, they don't mean that we're changing federal law or anything like that, but it also means like how you're showing up in your practice site. Bring this conversation up. Ask your provider, what are their thoughts on this? What are their
Hmm.
opinions on this? If they're on social media as physicians, ask them to step out there on your behalf, on the behalf of the profession. You never know, but no one's
And
coming.
And if you don't feel comfortable doing that, then, you have the option of starting a conversation here on our
Yeah,
platform.
on our
So
platform.
comment in the comment section, send us a message on Instagram, whatever it is. Let us know your thoughts. It's
Yeah,
important for you to have opinions about these types of things so then you can
absolutely.
fight for the
Yeah,
things that you care about. This is part of the whole trust yourself thing, but your opinions matter.
it
So
does.
let us know what you think. Let other people know what you think. Start conversations here. But
Yeah.
thanks, Sally, for that lovely summary of what's been going on in pharmacy. And I think a lot of people will learn a lot and be inspired
And be
by us.
inspired.
But yeah.
I hope the title of this is Kerfuffle. I saw that in Michael Hogue's statement. The Kerfuffle. I was like, oh, that's the vocabulary term I'm going to use. That's going to be our title, the Kerfuffle with the AMA.
There you go. Well, thank you so much for listening. If this episode speaks to you and you think that others may benefit from hearing our stories, send this episode to them. This will help us reach more people that way.
Yeah, thank you so much. And this episode will be available on YouTube, Spotify, and Apple, or wherever you get your podcast. You can absolutely connect with you and I through social media. All of our handles will be linked in the episode description below. And remember, you sharing, reviewing, liking, subscribing to our podcast. This is how we are able to grow. Engage with us, comment, send us messages. This is how we are able to know the topics you care about and you want us to lean more into. Maybe you just like to see Thu lose it and get like super hot and fired and spicy. Maybe that's what you like. So we'll look into more topics so we can give you what you want, because this community is for you. It's for all of us. And yeah, don't forget it ever. At the end of the day, we got this.
We got this.
We got this.
Bye, guys.
Bye, y'all.